exactly all the medical post-graduation programs in India, how you can get even in India part of it. So basically, today's session is how to really become a good doctor, ease in medical PG admissions in different countries. The focus will be on the admission criteria, what they are expecting from the students, what the students should be aspiring. So that is going to be a critical component into that. And we always believe the quality education and successful career is the fundamental right. So no country is good or bad. The colleges may be good or bad. And that is why it is important that we need to align the country based on your preferences. It is not the USA is better or UK is better or Australia is better or Germany is better. It is not the country which is better for you, but it is important what is your long-term career goals and what are the basically easy pathways across moving forward. Second, always is a major component is the cost component because the money is equally important. As you know, in India also a lot of colleges are there where the fees is very, very high. And in medical post graduation, if you look at the specialization also matters a lot. Somebody says I want to go to surgical branches, somebody says I want to go to gynecology, somebody says I want to go to clinical courses. Now, as you go for any surgical and higher end courses, definitely competition is more severe. And how we can really beat that competition, and even despite not very, very high marks in NEET PG or your profile, how we can get into the premier institutions globally. That is what is the today's theme part of it. India MDMS, the seats are very limited, particularly if you're talking of top 10 branches. It is a difficult admission. So there are almost 31 specializations today in MDMS part of it. But it is a difficult task if you are not able to score good marks in the NEET PG, then it becomes a big challenge part of it into that. I got many awards. Champions of Change was the award by Venkaiah Naidu ji when he was vice president. This is a Niti Aayog's award for 25 years in the service. We are working for last 30 years. And even medical post-graduation, we have completed more than 20 years in medical post-graduation. This is our fora. We have big team in India and internationally in different countries. USA, we have big team. We have the affiliated hospitals in United States. We have a team of doctors. We are a team of academicians across the globe. So we have been getting a lot of things. So it is not only the Indian counterpart, but we have the resources which is there who are year by year. They have been helping admitting. There are a lot of program directors are with us who actually admit the students for residency program, for physician associate program, or any other programs across the globe. So ours is organization of academicians, admission officers, industry experts, the doctors, the hospitals. We have brought that all into a single platform. And that is why we have been getting a lot of award. I was also nominated for Padma Shri once. Pride of Nation Award, 1971, we won war with Pakistan and Bangladesh was created. 96,000 Pakistani soldiers surrendered, which is after World War II, second biggest surrender in the world. We won this war in 14 days flat, and this is celebrated at Delhi at Vijay Diwas. You can see the General Bakshi and former Air Chief. So it's a big function, and I was felicitated with the Pride of Nation award. It's a very, very prestigious award getting from the defense veterans and all. Rajnath Singh ji was the chief guest at that particular function. Many awards by Nitin Gadkari ji, Maharashtra Gaurav Award, and so many awards actually. Devendra Fadnavis ji, corporate social responsibility. We have been working in the rural areas. Uttar Maharashtra Ratna was very prestigious. Along with me, Lata Mangeshkar ji and ex-president Pratibha Patil also got the award. And this is a very, very prestigious award. Vinod Taude ji, former education minister. We have almost 35 Best Career Counselor Award in India. And in London, both houses of parliament, like we have Rajya Sabha, Lok Sabha, they have House of Lords and House of Commerce. Both have felicitated for 25 years. Recently in medical, the Shushrut and Charak, you may be knowing, are the pioneers of medical history. Our first doctors, they are first surgeons, they are called. And Government of India has constituted Shushrut Award by them. And I was a non-medical. I'm a PhD doctor. I'm not the allopathy doctor. And along with me, the top doctors in India, the AIMS directors were honored. I was the only person who got award. This is one of the very prestigious award in medical. And at that time, Mansukh Mandviya ji was the health minister, and he administered that particular award. It's very again a prestigious awards for us. In United States, as I said, Dr. Donald Martin heads our team. He was ex-dean of Columbia University. Columbia is Ivy League university. You may be knowing, top five in the world. He was almost 17, 18 years admitting the students, giving them the scholarships, admissions. University of Chicago. This is the one university has produced more than 100 Nobel Prize winners. Booth School of Business is number one MBA college in the world currently. So we have the team where professors from the Northwestern University, the ex-tenured professor from Indiana University, Northwestern University, Yale Ventures, they are now with us and who are assisting the students. It's a teamwork what Astute has got, which is why we have the hospitals. We can get a rotations in any hospitals. We are almost 450. So we have our hospitals affiliated, and through our partners, we go for a lot of hospitals. Almost like 43 years of service, and he knows in and out of the American system, the admissions. So we build a profile. So we are career counselors. We build a profile for the students so that they can get admission internationally. In India, there is no profiling is needed. You give the NEET PG exam. Based on the NEET PG exam, your admissions are happen. But in India, we handle complete admission process in India also, purely on merit. No donation, no management quota. In fact, we are against the donation by paying a single. You have to pay the fees which is specified by Government of India or state government on official website. Not a single paisa fee to be paid other than what is a merit based fees decided by the government itself. And that is our strength. And we get admission to very low mark students also, because our admission system is lot of problem in admission system. It is a decentralized. Supreme Court this year also has gone through lot of irregularities. They have given some orders. Government of India is working very actively to plug the loopholes in the system. But since it is a very complex system, and we have almost like 27 states in India, it is not an easy task for even Government of India to plug in into that. But government every year is moving better and better, and that is where the we pitching and we work with the government so that we provide every student gets admission purely on merit, and we handle end-to-end admission processes. So we have whether government colleges, private colleges, or deemed universities, all the three categories of the colleges, we handle admissions in India, starting from filling up the application, preferences, counseling round management. People don't apply in India. That is why they don't get admission. Now, many times people don't know how to get the admission in Himachal Pradesh. Oh, I don't know whether Himachal Pradesh. I want to get admission maybe in Chandigarh tomorrow. I'm in sitting in Maharashtra. I don't even think of how I can go to Chandigarh, how I can go to maybe Punjab. Last year, one girl went up to the Amritsar also. Now, what is happening is many times you are not filling the application form. That is the first hurdle in an Indian MBBS, MDMS admission system. You need to be understanding the admissions part of it. Like Maharashtra government has got a certain rules for the MDMS. You should be a domicile of Maharashtra, or you should be basically studied in the college located in Maharashtra. Every state government has different regulation. You can go to tomorrow Bhopal and Indore, Madhya Pradesh also. Madhya Pradesh government has a different regulation. Gujarat government has different regulation. So we need to comply with the different state government regulations. And first thing is intention to apply. I always say, fill up the forms. Whether you are able to get admission or not getting the admission is the secondary part. So as you are filling the central government form, which is MCC form, every state government for government and the private colleges are different policies. Private colleges, you have to go across countries and apply the things. Now it is a decentralized admissions. Simultaneously, the central government and 27 states, the admissions are going on. If the student applies to 10 different states, maybe he's a brilliant student, he may be getting maybe 600, 650 marks, and he applies to that particular college, maybe he will get out of 10, maybe 8 colleges admissions at different places. Now he's going to take admission in one place, 7 or 8 places he's going to refuse. So what happens? The vacancies come in the, you will feel, oh, cutoff is very, very high. But in second round, there are so many vacancies come because the same student is applying to multiple places. Now he cannot take it. So that is a disadvantage of that. So what happens is that normally first round and second round, most of the time goes dummy rounds actually. Very, very people are not able to really get it. And it is the artificial scarcity which is being created. As I said, a government is working on that. Somebody who is getting maybe in Pune, BJ Medical College is a great college. Somebody gets admission, maybe that people in the next round may move to AIMS because AIMS process is going in parallel. So now in the BJ medical seats are vacant, then all reshuffle happens from one college to another college, student move from private to government, the student move. There is a reshuffling happens. So in the later fag and May, there is lot of things happen. So multiple application, parallel counseling round, dummy students were planted many times. So government, various state governments has started asking for money. Even recently MBBS admissions are going on. The Karnataka government says, okay, no, pay 1 lakh deposit. If you want to come to second round, first round you are allowed to go without money, but second round you please pay 1 lakh rupee deposit. Now, what is the purpose of that 1 lakh rupees deposit? Is only the serious candidate comes. Otherwise, somebody is very high. He's already sitting in government college. He's already got a government college, but he still goes and fills the form for Karnataka. Just to play with the system, sometimes intentionally also. A lot of coaching industries pushing this student just to create artificial scarcity in the market so that the people do it. So Karnataka government, Uttar Pradesh government has putting 2 lakh as a deposit. Deemed university has the central government has put 2 lakh rupees as a deposit. The purpose of this deposit is the sincere students comes. Those who want to take admission, please come. Otherwise, for 3,000, 4,000 rupees has no value today. Anybody can fill 3,000 rupees, 4,000 rupees, participate in round. Once you get admission, refuse the admission. And all India rank is something most misleading part of it. Admission doesn't happen on a all India ranks. Admission happens. Suppose you are all India rank is 25,000. Now tell me, out of that 25,000 students are above you in India. How many from Maharashtra? How many from Karnataka? How many from Kerala? How many from Jammu Kashmir? Do you have the number out of that 25,000? Because you have to apply for the state government. At that time, this rank has no meaning. Out of 25, how many students of Maharashtra are there? That is important. So your state merit list is going to be different. Your category merit list will be different as SC, ST, OBC, now the residency quota, EWS, defense. So many different quotas are there. Every quota, every state is a different merit list. We are playing in one state around 7 to 8 merit lists many times. And if you think of 27 states, how many merit lists are we preparing it? What is the meaning of an all India rank if so many merit lists are being prepared across India? And the people get confused. People compare last year. Oh, last year this marks I got it. Every year is a new year. We handle this complexity of the admission. So somebody with 500 marks may not get admission. Somebody with 400 marks will get admission. That's what is. And again, purely on merit. So because you don't understand the admission system. So if anybody is interested in MD Indian, I have written MBBS by mistake. It is a MD-MS admissions part of it. So let's move on to the international part of it. So India, anybody is interested, I can take the questions at the last, but you can basically take a one-to-one appointment and I can handle the complete admission process. So UK, Australia, Canada, New Zealand, and now Germany. If you go to these countries, 5 countries, US, UK, Australia, New Zealand, Canada, National Medical Commission says if you have done the post graduation, you can come back to India. Day one, you can start practice. No questions asked, no examinations, nothing. The day you come, so you will be start basically practicing in India. So five countries are going to be very, very critical. US and Canada always go together. But now, as I said, Canada has got a PR requirement, which is taking minimum 2 years now, may go to 3 years, and that is why it has not become a feasible destination. Previously, it used to take 6 to 8 months time, so it was acceptable. Some of the students still are going for some other courses in Canada and hoping that after 3 years they will go to the PG. But minimum 3 years again will be required for them to complete the course and get a residency path. UK, Australia, and New Zealand has almost a similar process, part of it. Now, everywhere, the focus is on diagnostics. What makes a doctor better than another doctor? If you can diagnose a patient, you can treat. You are expected to know how the heart functions, how the kidney functions, how the different body part. But what is most critical, if the patient is coming to you and is telling, I'm facing this problem, can you diagnose? If you are able to diagnose, then the line of treatment is clear. So we say some doctor is great because their diagnostic skills, and these are the skills now going to be tested in all medical PG. Even NEET PG currently is very, very highly tilted towards diagnosing the patients. The national exit exam which is coming will be exactly. So now the World Federation of Medical Education has signed a 10 years MOU with National Medical Commission. So India's National Medical Commission examinations, the next examinations, the USMLE exam, UK has scrapped the PLAB, you may be knowing. UKMLA is the examination, Australian medical, all are going to be same. So India will be introducing shortly the national exit exam. So MBBS students for after 4.5 years take next one. If they qualify, they do internship and then do the next two, and then they get a license to practice in India. So internationally, so all this examination, whether next or USMLE or PLAB or now the UKMLA, AMC, 95% going to be same exams. So once you are preparing for national exit exam, you are preparing for 6 countries together. Because now currently NEET PG is at a different level, USMLE is different. USMLE has made very, very easy recently. From 2023, the new USMLE is there. But earlier, the USMLE weightage was very, very high, very difficult examination. Now it has become 100% clinical examination, no theory part. I will discuss it in later. But most importantly, the weightage is just 15% now, 15 to 20. Few hospitals will take it 20%. They did a big survey in United States and they found out higher marks in USMLE does not mean better doctor. Higher marks in NEET PG does not mean better doctor. And that is how this concept of come as the diagnostic. So now worldwide, these examinations will cease to be an admission exam. So when the national exit exam comes, initially it may be for admission, but later on it will be converted as a licensing exam. These are the licensing exam. You want to take US medical licensing exam for the practice part. So the clinical hospital skills are most critical. And that is why I always say, even for MBBS student, go to a country, English speaking country, even if you are to go to international today, this year, large number of doctors went to United States, part of it. US has been always ruling it in medical education because it's a structured admission process. You know what is to be done. UK, Australia, New Zealand are also great. You have to give the licensing exam earlier to PLAB, UKMLA, you do 1 year internship, you get a GMC license. You get a license to practice in UK. Then you keep on applying for post-graduation. They will call you, they will take your interview. Long journey. Most of the students are taking 3 to 4 years just to enter the PG in UK. And then after that, if you are 4 to 5 years, so 8, 9 years earlier, it was okay because you are going to UK for settlement. Now it is becoming very, very difficult with new immigration laws. US is still trending. Out of all the doctors in United States, currently 30% are Indians. And today there is a severe shortage of doctors in United States. So maybe engineers, there are overcrowded, there are job problems in engineering, management, and other stream, but medical is trending in United States currently. 3 to 4 years you can get a green card. H1B is non-cap, no lottery system for H1B or anything in United States. Australia and New Zealand has similar system as the UK. You have to get an interview. So you get a licensing exam, take an internship, do a license, get a license, apply. So people go to Australia to settle it down. We handle all UK, Australia, New Zealand. Maximum number still goes to United States. So there are two programs. Residency, you are already must aware. I'm touch base. But today we are going to talk is basically of another program, that is a physician associate program. You don't need USMLE exam to practice in United States. USMLE is only one of the examination. It is not a sole examination. Period. So you can be orthopedic surgeon practicing in United States without even touching the USMLE. Even though the USMLE, the weightage has reduced, but it is definitely a difficult exam. It is not a very, very easy exam. It is not an exam that everybody can crack. Let's accept the fact. Previously, people used to go when the USMLE was used as an admission exam. At the time, people used to go to United States 2 years, 3 years. They used to study. There were Kaplan classroom sessions they used to take, and then they pass it. That is how the 30% of Indians are there. Indians are good in examinations as it is. So you can crack that examination, but that is only 15 to 20%. But it is not an easy exam. You feel that everybody will be able to crack the part of it. Even though the results are different. Step one, like USMLE, is almost 92 to 93% student passing first attempt. So I'm going to introduce the physician associate. This is a medical post-graduation program. Okay, so let's understand. So American system in slightly. So American system has a pre-medical concept. In India, there is no pre-medical concept. Now, some of the colleges has started pre-medical, like we have Parul Medical College in Vadodara. They have started. Pune, some colleges are starting. It's a 4 years of pre-medical programs into that. And then you can go to the basically, you take the prerequisite subject and then the physician associate. Or there are students going for doctor of medicine or doctor of osteopathy, which is equivalent to MBBS in India. Okay. So now this 4 years of pre-medical can be anything. Okay. So you may be BSc biology student, you may be a homeopathy student, you may be Ayurveda student, you may be any student of biological sciences. You can be occupation therapy students, you may be a microbiology students, any person who has a biological base, who has done bachelor's in biology, can go for the allopathy practice in United States. So I can do a transition of a homeopathy doctor giving a allopathy practice, and he can become an orthopedic surgeon in United States. He can become a gynecologist, and the starting salary 1,50,000 to 1,70,000. Now, any students of biological science in India can go to both the programs. So either he can go for 2 to 3 years program of physician associate where there is no USMLE required, or even Ayurveda homeopathy student can go to first doctor of medicine or doctor of osteopathy courses, and then they can do the USMLE, because that then they will be able to create the base for it. This is one of the most structure, and not only for this, even dental, all nursing, lot of students are going. There are integrated programs now coming. 4 to 5 years of integrated program. You just go and finish up your post graduation admission in United States. So physician associate, all the information about this is a medical PG program, aapa.org. Note down this website. You don't have to go to any other website in the world. This is a single website. This is a government of United States official website. Like we have got a National Medical Commission. AAPA is American Association of Physician Associates. AAPA. This is the government of USA official body. You will find complete admission process, names of the universities where you can apply, what are the admission criteria, what you should be doing it. This is a 2 to 3 years program, 24 months to 30. So basic branches like internal medicine or MD medicine, what we call in India, basic radiology and all are 2 years courses. All surgical courses, orthopedic surgeon or any other surgeons, I will show you the courses which are there, are 3 years. These are university courses. There are 308 American universities provide this course. So you go to USA, you study 2 to 3 years in American university, and you are a licensed practitioner of allopathy or gynecology in India. In whole of India, we are the only one, as per I know, who handles out of 308, 175 universities, okay, and give admission to international students like Indian students. Others are reserved for American citizens or green card holders. 175 universities, we basically handle this part of it. It is clinical based. It's a very, very strong, almost like 2000 hours of clinical rotations they do it. It's a master's level program, very, very reputed program. This started in 1967. This program is a very old program. It started in 1967. Earlier, it was the program which was started in 1967 was to assist the doctors, to assist the residency doctors. But later on, it got full-fledged recognitions. Now you have got basically, in short, they are called PAs in United States. Almost like 500 million patient interactions. One of the most reputed till date, almost like 178,700 practicing. This is a 2024 officially published figure. So many doctors are, and the US population is very, very short as come 1/3 of the Indian population part of it. So you get admit into the PA program, PA university, and there is a certification like USMLE exam. They have got a PANSE exam, Physician Associate National Licensing exam. You go to any university website for this passing percentage of the licensing exam. Without licensing, you cannot do it. But this is a licensing after you complete the course. Most of the students, 96 to 98% student pass this exam in first attempt. 96 to 98%. Every university, you'll find large number of universities says 100% of our student passing first attempt. And second attempt, 100% across. Across the university, second attempt, 100%. So any exam which is a 96 to 98% student pass in first attempt is not a rocket. And you have to just pass the exam. It is not how much marks you are getting and all. This is a simple examination post completion of your PE. And you get and after 10 years, you recertification. In India also, like we are joining the points part of it. Very, very prestigious part. 50% almost, sorry, 28% is students going in surgical. 26% others. Others means the gynecology, palliative care, the public health, dermatology, addictive medicine. Those are 26%. Primary care around 20%, 13% internal medicine. You will find the internal medicine in residency is the highest, because residency, getting a surgical branches is very, very difficult. Surgical and clinical branches students are very, very difficult to get in United States in residency. And here almost 30% of your students are getting surgical specialties. So if any of the students who are good also, maybe he can crack USMLE also, but then he is not sure whether he will be getting orthopedic surgery, whether he will be getting vascular surgery. This is the Stream Physician Associate program, which is the best program because you become independent licensed to practice. So this is a program for particularly difficult branches. Otherwise, most of the students in surgical, there are students who go for surgical, but the number is very, very low. Most of the people go for the internal medicine, family medicine, emergency medicine, pathology, and all these streams. Whereas this program is specialized into almost 28% is into the surgical specialties. I'll show you what are the specialties. So there are three intakes into that: January, March, and so most critical, like we talk about in India, eligibility. We use the word, okay, if you want to become MBBS doctor in India, you should have done 11th and 12th with physics, chemistry, biology, and you should have scored 50% marks. And you should have qualified NEET examination. That is the eligibility to apply MBBS. So physician associate also has got eligibility. Let's understand what is the eligibility. Who can apply to the physician associate program? This is a program, again, I've talked about, is very high salary, 1 lakh. This is the last year figure, 1 lakh 25. Currently, it is trending some of the surgery. This is non-surgical branches. Huh? This is the lowest fees I'm talking about. Surgical may cross up to the 2 lakh also, part of it. So this is the salary, 1 lakh 25,000 to 1 lakh $50,000. If you stay, if you there are engineering students and other going to United States, 15 to $20,000 they stay full year, living plus food. If you take a lavish with a car and independent apartment, you are not going to spend more than 25 $30,000. Almost minimum 1 lakh dollar, means around today's rate is around 87 88 lakhs rupees, is saving after deduction of the your expenses part. One of the highest earning part of it. And that is why ROI of physician associate is very, very high. Less than 1 year, most of the students repay the bank loans. If you are going to United States, you are spending some money for all these processes. 1 year or maximum, if you take a purchase apartment or you take higher apartments, maybe 1.5 years, 2 years, you repay the bank loan. It is, and banks are giving from United States even collateral free loans. If you don't have property to mortgage, these loans are possible. Very, very attractive, cost effective. If your parent doesn't have money also, this is the program where you can do. And this is an easy program as compared to far easy than a residency is a lot of complications. I will talk about the residency there. So here the prerequisite is key. Prerequisite means eligibility. In India, we call eligibility. US talks of prerequisite program. What are the things? What they are going to look is university. Have you taken these subjects? Anatomy, physiology, biochemistry, microbiology, chemistry, organic chemistry, genetics, medical terminology, psychology, statistics, and hospital exposure. Have you taken your bachelor's degree? You may be MBBS doctor, you may be Ayurveda doctor, you may be homeopathy doctor, you may be microbiology doctor, anybody, but you have taken these courses, you will be eligible to apply for physician associate program. So what is we do it? If you are in BSc biology, you are not taken anatomy, maybe subject physiology. Okay, we will get you done. So you fly to the United States, you do these programs of prerequisites, and you go into the PH. So there are integrated programs now where you go to the United States, you complete these programs in the university system. You can take some of this program online also. While the students, maybe I don't know today how many students are from first year, second year, third year, MBBS or any other program. While you are in India, if you are in college, suppose you are MBBS student and you have taken anatomy as a subject, just appear for a paper online into the American university, get a credit from American university. We'll guide you. So as a second year, third year, you finish these subjects while you are pursuing. And if you are already passed out the students, maybe you can fly to the United States, you go there, you study it, and you enter into the PA program. Maybe it will take 1 year, 1.5 years more. So the 2 years of degree may becomes the 3.5 years. But in 3.5, 4 years, may you become a postgraduate licensed practitioner. Doesn't matter actually. Either you can do it. So that is the best way forward. Prerequisites are mandatory. There is no choice for you, the prerequisite. Now, all the university, I told you AAPA.wow, they got list. And out of this 11, 10 actually, healthcare experience is most must for everybody. So here you can pick and choose one. Some university says, no, all are not required, all 10. I will take 4 or 5 subjects. You should be mandatory. Now it is every individual university will decide out of this 10, But we as a in Astute Academy, we say you complete all 10 so that you can apply to wider range of universities. So some university I may not be getting surgical, but another university I may be getting surgical. So I should have the choice to apply, and that is why it is mandatory for this. Besides it, the TOEFL and GRE base level examination has to be taken. Now, what are the courses, the specializations available for PA? So primary care में family medicine, internal medicine, pediatrics, base level. Internal medicine may also cardiology, critical care, gastroenterology, hematology, infectious disease, nephrology, neurology. A lot of students are going for neurology. Actually, currently numbers are increasing. Basic neurology as well as neurosurgeons also. Rheumatology. Just think of emergency medicine, pediatric specialties, surgical, all possible surgical specialties, cardiovascular, bariatric, colon, general surgery, neurosurgery, oncology surgery, orthopedic surgery, pediatric surgery, plastic surgery, thoracic surgery, transplant surgery, trauma surgery, urology, vascular surgery. Just name of the surgical branches which is possible. All other addictive medicine, anesthesia, dermatology. Lot of dermatology. Now, dermatology is very difficult in residency. Students are not getting dermatology. Here it is, they are giving you at a cakewalk. Genetics, nuclear medicine, gynecology, occupational medicine, ophthalmology. Ophthalmology is again difficult in the residency. You name the branches which is available, you are specialized, you get a license to practice in United States. Very, very powerful branch. No USMLE required. Nothing is required. What is required is a prerequisites. That's all. You complete these courses. That's all. You can do this in some in online, some in offline, and you finish off it. So when you fly to United States, you can do some in classroom, the particularly subject which are lab components. So some of the subject you have to take in the lab also. Chemistry is one subject which normally troubles the students because normally in MBBS and all, we are not very strongly in chemistry based. Internationally, it is very, very high. I don't know, for some reason. Now the Government of India National Medical Commission is working on the syllabus. You will find some of the things which is coming. So we have the most part of chemistry is quite strong internationally because it's a biochemistry, regular chemistry, organic chemistry. All three are there basically. So all three are different subjects. So it is not you have taken all the subjects together. You can take online some of the things. But if the chemistry requires a lab component for this, we need to take in a physical mode because the labs are there. So you fly down to United States and you will be there. And as I said, these are such a one of the cost-effective programs which are there into that. So integrated may also we have integrated some of the things. Now prerequisites cannot be done individual subject. Yeah, I'll go and take chemistry. International student has to enter either in bachelor's or master's. I will take the questions at the end. You can start typing the questions in a question and answer tab. I will do it. You can raise the hand later on. I can unmute you. You can ask the questions by verbal also. But if you can type the questions in a question answer tab, I will be able to take the questions. So you cannot go, you will not be granted American visa if you are not going for bachelor's or master's. So there are certain people go for BSPA program where Bachelor of Science. So you transfer your credits there and balance you complete it in a PA program or MPHPA, Master of Public Health. Master of Public Health is also a good program, but it doesn't give you license to practice. So MPHPA are integrated programs are there, what they call pre-PA, PA programs. You can complete in 3 to 4 years these programs. It depends on the your how much capacity you have, how much you are ready to study, how much are you comfortable in online. So with by taking some subjects online, you can reduce it. But some subjects mandatorily be taken in the physical mode, as I said, particularly those requiring the lab components part of it. So the physician associate is program which is for everybody. Let's come to the residency part also. Because residency now the processes has simplified. It is not simplified, but is structured, I would say. We know what parameters on which the residency admission happens. We ourselves as a residency hospital, we speak to the program directors, they know in and out. We build a profile. So Astute is a career counselor. We build a profile so that you get whether you are going for physician associate or residency program. Residency is a free program. So you get almost $5,000 to $10,000 per month as regards the thing. And now the USMLE is licensing in true sense. It is a 15 to 20% weightage to admissions. 2024 was the first batch with the new admission system. So 2024 onwards, the new batches with a new admission system, where now the weightage has changed to the thing. But USMLE examination is also changed it. The biggest problem of USMLE, once you pass it, you cannot repeat for 7 years. And passing is not difficult. Those who study Step 1 examination, passing percentage is close to 90 to 92% in some years. First attempt passing is 90 to 90. NEET PG exam, most of you have given recently. NEET PG has a passing percentage of 50%. Half the student qualify, half the student don't qualify. And those who qualify, not everybody gets admission of their choice or their college. USMLE is a problem. Once you pass it, you cannot be repeating it. So we take the separate sessions on USMLE. So USMLE from it is become 196 just out of 3. Previously, you require 250 marks in USMLE step 1. It's a pass and fail now. You don't get a marks now. The step 2 CS clinical skill is scrapped. Step 2 CK is only examination which is left, where you need to score good marks. If you are not able to score good marks in a step 2 CK, then mandatorily you have to take step 3. Otherwise, step 3 is not required. But if you are getting a marks less than 250 in a step 2 CK, then it is essential that you take the step 3 exam. Step 3 will give you the complete permanent licensing pathway. Otherwise, if you are taking step 1 and step 2, you have only the 7 years window. But step 3 will close that 7 years window also. So it is sometimes recommended if your profile is not great, if you wanted to go to surgical branches or clinical branches, definitely it is essential that you take a step 3. The process has changed. Previously, it was not required, but now if you are not able to score good marks in step 2 CK, it is required. So USML is only 15 to 20. What is others? Research projects. So now if you go to the IRAS is the basically application, electronics residency, electronics admission process. You need to have 10 experiences. They have decided, I don't want 11 or I don't want 15. What you do is not important. I want 10 experiences. Experiences mean it can be voluntary experience, it can be work, it can be research, it can be training, it can be maybe you have got a club membership, if anything. You may be having some good hobbies, which is really transforming it good. You may be good in sports, you may be good in cultural activity or whatever may be. 10 experiences. They don't want anything extra. And out of 10, 3 has to be substantial. Substantial means something which is continuously you are doing. I go to blood donation and just donate my blood once. So that is not sufficient. Are you going regularly for blood donation? Are you encouraging others to donate the blood? Have you conducted any the camps for blood donation? Have you done any awareness videos to be created? Awareness videos are very important. They want to see you before the interview. They want to see you before the interview. Many times what happens on the paper, they evaluate. Most of the students, they are getting application from more than 100 countries. It is very difficult. Our percentage in MBBS, we don't score very, very high marks in percentage. In USA, it is a 4.0 GPA. And many students are 4 out of 4 or 3.9 or 3.8 out of 4. In India, even topper doesn't get a very, very high percentage. On paper, many times the percentage always creates a problem. So they want to see you speaking. Maybe you talk about plastic ban, you can talk about the organ donation, you may talk of hypertension, you may talk of India is a diabetes capital, how I can avoid it. So they have very structured program whereby you have to do 10 experiences out of this substantial, which is an impactful, meaningful three experiences. And then we want to see the research projects. So they say peer-reviewed research, non-peer reviewed, you have poster presentation, you have oral presentation, if you have written any book chapter part of it, any article, one I require. I don't want you do 10 research projects. I don't bother you are doing 10 research projects. There is no space anywhere to now add it into the eras also. If you are doing too many research, but many students feel, oh, I'm doing so many research projects, but I missed out on oral presentation, I missed out on poster presentation. Now that is not expected. They have very categorically said, okay, I want to see you sample. I want to see the alignment. Don't want to see the numbers. I want to see the depth on which you have come. How versatile are you? 25 years back, you never thought of knee replacement operation. Today, we are doing heart replacement. Maybe after 25 years, we will do brain replacement operations. We will just change the brain itself. We don't know. The medical field is changing. So they want to test you for future researchers. And they have very clearly done it. So we get it done. So we have doctors team, we have academicians. As I say, we will get this done. Social, environmental, clinical rotation in US hospital. We have 450. You want dermatology rotation, you want gynecology rotation, you have surgical rotation. We are there to provide it. We provide letter of recommendation from American doctors. Complete end-to-end part. Their documentation, very robust documentation has to be. Many times people apply to 500 programs, they don't get even interview calls. So based on your first application, your USMLE, MBBS marks, all profile, they will evaluate and they will. So they want to see you before calling for the interview. If your good videos are there, 3 minutes video, 2 minutes video, not big videos, how the body language, how you speak. So communication skill, we emphasize that. So we have special training programs how to give the interviews. We train you for the interviews, residency interview, and match and soap admission process. Somebody who designed the algorithm for match got a Nobel Prize. 52 parameters. It's a complex process. People don't understand. People feel USMLE, USMLE, USMLE. USMLE is now 20%. 80% is non-USMLE. It's a difficult exam. You have to pass that difficult exam. I'm not saying. So not everybody can get a residency admission. Let's understand. And particularly if you are looking for surgical and all, but we are very structured. So if you are in first year, second year MBBS, please connect with us. We have to build all the profile from first year, second year. You cannot be passing out and then say, if you are passed out already MBBS, then you have to take 1 year gap at least. It is not possible that you have to complete all these parts even unless you dedicate at least 1 year or 2 years of efforts. Minimum 2 years of efforts, we always say, if you want to get a residency admission. Physician associate on the top, you just fly down. 6 to 8 months in advance, you apply. It's a regular admission process. You go to an integrated program and then you finish off that particular. But this is a program which is very, very good program. Residency is very, very valuable part. So we have the team in United States to handle all these parts. So even research projects are done. We have the team in India, we have team in United States, which will be helping the students get into that. So USMLE, profile building, US hospital rotation, letter of requirement, documentation, program selection is most important. People don't know where to apply. There are 40,000 seats, 42,000 students apply. New York is a great city. New Jersey is great. California is great. Oh, there are pile up of application in New York City. And maybe Ohio State or Michigan State or any other state, Washington State, there are less application. If everybody applies to AIMS, will everybody gets AIMS? You get admission based on your profile. But if you don't apply, only apply to New York, there are so many applications. Less than your profile student gets admission. You are great profile, you did not get because you applied to a brilliant one. Only AIMS you applied. Some other person had applied to maybe a deemed university. He got admission into that college. because his profile was weak. He was not able to get to AIMS. So in NEET PG, somebody has got 300 marks in NEET PG and he applies to AIMS, he will not get 300 marks student to AIMS. Let's understand, you get admission based on your profile. So you have to choose the program, or you have to choose where your chances of admissions are there. There is no merit list. In match process, there is no merit list. In India, when we fill preference form, we feel, okay, BJ Medical I don't get, I will get another college, then other college, then private colleges. Computer will look at the inter-se merit. No, US it is not. When you fill the preference form in the USMLE, wherever your maximum chances has to go up. Otherwise, less than your profile of the student will get admitted. You have brilliant profile, you could not get it. Very, very complex. That's what I say the algorithm, the person got Nobel Prize. It's a very, very complex algorithm with 52%. It is doesn't have the merit part. It is not based on your desire. Here, I want to go here. It is based on your profile, what you created. So we build a profile for 2 years. Three months, we will give you the academic, non-academic things. Every month we monitor into that, and we will make a perfect application. That is going to be very, very critical. Go to all the official website, NRMP, residency website. Those who are going for PhD, there is a fellowships also. There is a fellowship route also. A lot of people are come to me. I don't want to go to the residency, but I want to go to fellowships part of it. So there are private fellowships, and NRMP has got a fellowships part. ECFMG, as you know, it is the Commission for Foreign Medical Graduate. It will authenticate your degree, whichever college which is there. So now the India has got two pathways. Previously, it was only pathway number one, which is a license to practice. Now, when you are appearing for final, you can apply for residency. Previously, what was there? It was you have to complete the MBBS, you have to get a license, and then only you can apply. So there is the ECFMG pathway number 3, which doesn't require you to be a licensure. Even though eventually you get license in India, USMLE is the examination paper setters, examination conducting body. NBME are the paper setters. So they have got a mock test also. National Medical Commission in AP. You don't have to go to any forums other than this. These are official government of India. Don't believe in what counselor is saying. I will give some examples, even how the admissions are happening here. This is the data of step 2 CK. Green is the rejected, blue is accepted. All specialization student, this is non-US IMG data. International medical graduate, not US citizens. This is the international student. Even orthopedic surgery students are getting it. The last year, almost like a 238 marks student has got a orthopedic surgery. His other profiles was great. He was a surgeon almost more than 6 months. He was practicing surgeries. So you have to have a profile. If your profile is good, USMLE is only 20%. Please understand, this is the USMLE data. USMLE lower marks also can get it if other profile is good. And this is what is going to be very, very critical component part of it. So now it is 100% clinical. Don't give USMLE in second, third, fourth year. No, please. That days are gone. Only coaching industry is pushing. There is no benefit of taking early USMLE. Minimum when you are 6 months in internship, you have patient exposure. You are in the best position to take the step 1. Do not take it in second year, third year. There is no basic science questions in USMLE step 1. It was long back. 2022, everything has changed. Don't talk to even seniors, because seniors has given different format USMLE. And step 2 CK, you should be doing it. You complete your MBBS. Never ever break your internships. You complete your things. Go back to United States 2-3 months, 3 months minimum. Do rotations there, because then how the Indian doctors diagnose and how the American doctors diagnose is different. And then you give the step 2 CK, you will get very good marks. So USMLE is not a rocket science, but what time to take it? You can take NBME mock test, and when you are getting good, particularly step 2 CK, you should never be hurrying up, because once you take it 7 years, you can stop it. It is not a hurrying examination anyway. So we start mentoring the student for post graduation even as early as first year. Now it is no longer only a final year student, but from first year students and all are going. We build a structured part of it. You can follow us on the YouTube and all. So Physician Associate is the program, which is a very premium program. All specialties, only prerequisite has to be done. The day you complete prerequisite, you can apply to the PA program. There are integrated program, very good program. Don't need to get a USMLE examination. Without USMLE, you can be orthopedic surgeon in practicing in United States. Please do join, because these are the things where we are putting the all the links, where we will be putting a lot of stops, lot of newer and newer things which are there. So you can call astuteacademy.com. You can go and you can fix up one-to-one appointment on Astute Academy, or you can call up. The videos are available on astutepromo.com, part of it. I'm really thankful for joining large number. I hope I am able to answer your queries part of it. And I will be very happy you get connected with me, and I'll be happy whether in India or any of the 6 countries which are predominantly people are going. Thank you very much, and I will close this now the session, and we will meet soon. Thank you very much, and appreciate you joining.